Hello, it's Jim Kennedy, GP partner in Wargrave General Practice, and just updating you on some of the more general things that are happening in the practice aside from COVID. Uh, we, we are a general practice. We still do general practice, although sometimes it feels like we have an inordinate amount of COVID to get through. We are re- open for business for normal, routine medical conditions. So a significant number of you will have had outreach from us over the past few months, encouraging you to come in for your routine reviews or for other healthcare monitoring and optimization. Uh, Obviously, if you can respond to that and come in, it is very important that we look after the ordinary conditions, not just COVID. Uh, for any of you who've been in contact with the practice over the last 12 months, you know that it's a very COVID secure environment. We go to great pains to keep it as safe as possible uh, for our most vulnerable patients, and therefore you're in an extremely safe position coming into the practice. As you know, all the practice staff have been vaccinated. We have full PPE in use and very good processes now for protecting patients and their loved ones when they come in for consultations. So look forward to seeing you in the practice or in contact with the practice through telephones or emails to do your routine healthcare. Related to that, can I raise one or two other things? We are extraordinarily busy. In some 30 years of working in general practice, this is the busiest I've ever seen it. We reckon our demand at the moment is about 30% above what we would expect at this time of the year. We are going hammer and tongs to try and meet that demand. But please do be patient with us. A little bit of kindness goes a long way in helping our overstretched reception staff who are doing their absolute best to try and accommodate everybody with contacts. A little bit of background as well about some changes in personnel that we're having. As you're probably aware, Mark Puddy, our esteemed former senior partner, is retiring after 31 and a half years service to the community of Wargrave. Do not despair. Mark is not going very far. He's just taking a month off in April, which he certainly deserves at this stage. And then he's coming back in May, slightly shorter hours, working with us as an ongoing doctor in the practice. And he will particularly continue with his excellent care of patients with diabetes, where his hard work over the years has made us one of the highest ranked practices in the Thames Valley for diabetes care. Other changes in personnel, obviously with Mark retiring, it creates an opportunity, and we're going to be joined by Dr. Faye Hext, who may be known to some of you already as she's worked in the area over the years, and she will be joining us as a partner starting in May, and we're absolutely delighted to be welcoming Faye. Teresa Abbott, well known to you all, is currently off on maternity leave, but will be returning around the Christmas time. We look forward to that. Annabelle Menzies had taken some time off with her family and is now back working with us, and it's great to see Annabelle back as a member of the team, and I know she's much loved by our patients. Dr. Jenny Singh, unfortunately, we are losing her to Wales for a year. Her husband, who is coming near the end of his training as an orthopedic consultant, has gained a very prestigious fellowship, working for a year in a highly specialised unit in Wales. And Jenny is going there to do a lot of hill walking and admire the sheep and do some general practice as well. Our former trainee, Tiffany Tang, is back in the practice for a little while. Tiffany is again well known to everyone, and it's great to have her back in the place where she trained for a year. So that is our GP changes. We have a number of new services starting up as well. You'll all be familiar at this stage, I think, with Tana Kopis and Abha Patha, who are our two clinical pharmacists who are doing sterling work on sorting out medications. We have our social prescribing team led by Justin, who've been doing a lot of excellent work, particularly during COVID, supporting people who, with isolation and other effects from COVID, and particularly collaborating with all our volunteer organisations in this area and coordinating support for patients and the community. We're about to start a new project on Pharmacy First. This is in conjunction with our pharmacy colleagues in Lloyd's and the other community pharmacies in the area. And that will deliver a new service for minor self-limiting conditions where the pharmacist can deal with you directly and can even access medication for you. This week, we're joined by a new member of the team, which is a joint project with Mind, the mental health charity, and this mental health worker will be delivering support to people who are having mental health issues. As you can imagine, COVID has taken a very heavy toll on people's mental health, and we are in particular developing some schemes around better mental health care for adolescents and young people as the disruption of schooling and university and entry into the world of work has taken a huge toll on that part of our population. In collaboration with Woodley Medical Centre, we have an excellent and growing offering around virtual group consultations and webinars. And recent ones include some specialist webinars for new patients, people with diabetes, and we're developing a whole set of support packages for working with our local schools, targeting children, young people, and then potentially expanding it out into some of our university students as well. This hopefully gives you a little bit of an update on some of the things that are happening with the practice. We look forward very much to seeing you down at the practice, be it virtually or in person. As you know, we still do see patients, we always have, but to help with minimizing infection risk, etc., we do talk to everyone on the telephone or by video link first, and then try and do what we can through that mechanism, and then see those who need to be seen in person. So we look forward to seeing you at some stage. Cheers, bye.